Hi, my name is Anna. I'm a home care registered nurse, and I have found that there are a lot of videos on YouTube for putting on personal protective equipment that are specifically geared for people in the hospital, for healthcare workers in the hospital, and nothing specifically geared to the issues that home care nurses have to deal with. So I thought I'd make one. So I have all of my gear out, some lab equipment you might need, gloves. I usually bring 4. I wear 2 at the same time. That way you don't have to worry about hand hygiene between what you're doing. The mask, hair cover, gown, shoe covers, eye cover. This handy little feature goes on the patient's arm when you're taking their blood pressure. I bring in a bleach wipe for wiping down my equipment, the equipment that I have to take out with me, take in and then take out. So I'll wipe off my blood pressure cuff, my O2 sat monitor, and my thermometer. Unlike in the hospital, we don't have the equipment to leave in the room and give to the patient, each patient. So we do have to sanitize it. I also bring in some alcohol wipes. This I use on my phone if I have to bring in my phone. For example, if I need a translator, I have to call a translator on my phone. This does happen sometimes. And sometimes I have to call the doctor. I wipe off my phone with the alcohol wipe. I found that if I wipe off my phone with the bleach wipe, the touchscreen no longer works. So I'm not really sure what is recommended for wiping off phones, but if your phone doesn't work, that's certainly a problem. I also bring a garbage bag. This one I find I have to use sometimes if I have to wear a jacket in, say it's raining. I do work in California, so we're fortunate with our weather, but there are times when I have to wear a jacket, and if I had to put on all this gear with my jacket on, I'd be sweating and very uncomfortable. So in the past, it was recommended that instead of putting our stuff down on the ground or on a chair or on a table in the patient's home, that we hang things on the doorknob. These days, that's probably a no-no. So garbage bag comes in very handy for that. And of course, the hand sanitizer. This, I'd like to explain. It's very handy. I don't have to bring in my nursing bag because I certainly don't know what the environment might be. And it's really hard to wipe off your whole bag. So I bring in a paper bag. The grocery store paper bag is really handy because it stands up straight. It's got good handles. I line it with a plastic bag. It's clean, not sterile. Nothing going in is going to be sterile when we go into a home anyway. So clean is good enough. I will also use a clean sheet of newspaper. This comes in handy, especially when I don't necessarily need a wasted chuck for it, like I'm putting my bag down. When I go into the home at the doorstep, I will use the newspaper because I'm going to throw that away as soon as I'm done there. And I'd like to show how I put this on at the doorstep. So we'll do that next. Hey, so we're back. I already have my hair cover and my mask on because I put those on in my car. So we're going to have our gear already started before we even get to the door. So I walk up to the door. Of course, I've already made an appointment, but before I even knock, I'm going to get my gear on because that means as soon as the patient or the family member opens the door, we're going to be within 3 feet of each other. So before I even knock, I will start to put on my gear. So as you can see, it's really handy. But like I said, putting these on while holding a bag can be a real trick. Even without holding the bag, it can be difficult if your balance is bad. So sometimes I'll lean against a wall. Of course, we don't know if the wall is clean, but it's better than falling over. And of course, we don't always have a seat to sit on. while approaching someone's door. Of course, if your balance is good, you can go for it. Okay. I put on hand sanitizer in the car. Just want to point that out so I don't get a bad nurse. I'd suggest hand sanitizer between each item. So these gowns don't have the thumb holder. For the ones that do, you tend to get a gap at the sleeve unless you're careful. Like I said when we were filming the equipment part, I would normally wear 2 pair of gloves. It's almost inevitable that you'll have to take off a pair between tasks. And at this point, I can ring the doorbell. And hopefully my patient will be coming to the door soon and we can begin our visit. Hello, goodbye. We had a very nice visit with our patient. They're doing much better, but now I have to take my stuff off. So again, we don't want to contaminate ourselves. We take our gloves off, throw them away. Take my glasses off first. These I'm going to clean off with a bleach wipe, which I will do later because I have more bleach wipes in my car. Our gown, we can either use the inside out from the back method, or while you still have your gloves on, you can pull your gown off in the front. Either way, probably doesn't matter. This way, make sure you're touching clean surfaces and pulling the gown off inside out. If you pull from the outside, you would peel your gloves off when you peel the gown off. And that bag that we used for our jacket is very handy because now we can use it for our PPE, which we are going to throw away. Nurses' hands get so dry. There's a reason for it. Again, the trick with the shoe covers, same thing. If my balance isn't good, I'm going to lean against a wall, take the shoe cover off. If my balance is feeling okay and I'm not standing on a stairway, I will take the shoe cover off and desanitize my hands once again. Now, if we're lucky, there's a garbage can outside the home and you can throw away your PPE in the garbage bag right away. Or if the family is still available, usually they're standing there watching me take my gear off, you can then hand them the garbage and they can throw it away. Either way, try not to take it with you. I'm going to keep my mask on because I don't know if others will be around when I walk to my car. So mask and head cover I will take off and dispose of when I get to my car. So that's my PPE method as a home care nurse.